The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, CHD. Here is our headline this morning. It says, unvaccinated 17-year-old dies of measles, Health Ministry says. This is the Health Ministry reporting that an unvaccinated 17-year-old boy died of measles last night. The boy suffered from underlying conditions. When hospitalized 2.5 weeks ago, he was diagnosed with measles. This is Israel's 17th death from measles since the current outbreak began last May. Of the other 16 deaths, most of the deceased were otherwise healthy and infants and children with no underlying conditions who were, as always, they say, not vaccinated, whatever that means. Who better to talk about this than Dr. Suzanne Humphries? Good morning, Dr. Humphries.
Good morning, Polly.
It's like the same old script over and over again. First of all, I want to say it's tragic when anybody dies. A 17-year-old boy should not be dying in hospital of measles, but underlying conditions. I'm just going to hand this over to you before I ramble on about what I think.
All right. Well, we'll look forward to hearing your ramblings afterwards. I think I'll probably rock you up pretty good during this one. So Polly made me aware of this article yesterday, and I said, all right, let's do a little chat about it. Because it is a familiar story, and Lou has some slides that I created, and maybe we can just go straight to slide 2, which shows you the headline again. Basically, notice the first word. The first word isn't tragic, it isn't unexpected, it is unvaccinated. Okay, so that's always the message. These unvaccinated people are spreading measles throughout the land and threatening even the vaccine. The next slide, and I'd like to thank everyone on my X page at DRSUZANNEH7, because I put out a little call yesterday to see if anybody read or spoke Hebrew. And yes, I can use Google Translate, but it's really nice to have people there that can comment. And I did get a little bit of help from different people, so thank you for that. And this is what I'm showing you now is the website from I guess it's like the Ministry of Health in Israel, and they do have an English translation tab. And you can see there that it was last updated on October 23rd, 2025. So I find it a bit interesting that it hasn't been updated. It's very opaque as well. We're really not given a whole lot of information about the deaths, and I'll get to that later. So let's go to the next slide. And so what we have in summary is that we have 1,700 laboratory confirmed cases over the past 6 months, of which 437 were hospitalized, 39 were intensive care unit admissions. And it's said to be mostly ultra-Orthodox Jews with low MMR, or I should say measles vaccine coverage, because God only knows what they're giving over there. Probably a combination with varicella and et cetera. And so I did a lot of AI sourcing with this, as well as going to the ministry website. And it's well known that, at least in the past, that the ministry has lumped unvaccinated and unknown vaccination status together in many of their tables. So we really don't have any delineation of once vaccinated, twice vaccinated, or non-vaccinated. Okay, so historically, if you go back and look, when they did publish it, there were about 10 to 20% of the numbers were unknown in the cases. So there's been no strain or genotype reported. So strain A is generally the vaccine. The ones we usually see are B or D, and we don't know. We have no clue as to what the strain is. And we know that even though they're blaming the ultra-Orthodox, when I went and looked up what their vaccination rate is, it's 70 to 80%. And since they've started all this hullabaloo, it's gone up to around 80 to 84%. But apparently we need now a 99% vaccine rate for the vaccine to work. Okay, so let's just go back to the past a little bit. And I know that a lot of people that follow CHD and Polly and me have seen this all before, but I just repeat it because I'm always made aware that there are new people tuning in that actually don't know this. Young parents, maybe 17-year-old mom or something like that. Like, they need to know this, all right? So tune out if you don't want to hear it again. But this is a quote from Alexander Langmuir, considered the father of infectious disease epidemiology from the 1960s. And he was asked, why do you want to eradicate measles? And he said, with the same answer that Sir Edmund Hillary, this is the guy that climbed the giant mountain, I forget what it's called. And
Right.
Thank you, thank you. And he said, Everest, there it is, it's right in front of me. Because it's there, and to this it may be added, it can be done. He didn't say because it's a highly deadly disease and people are dying from it, because in fact, as we'll see in a minute, the death rates for measles had plummeted to over 99% survival rate. Okay, so, okay, next slide. We have numerous articles from the 1950s that talk about the measles and how doctors treated it, and doctors talking to each other, and how parents talked about it. And they said that they would use a saline mist placebo, that there were few complications, that they didn't attempt to prevent the spread of measles then, and use of antibiotics and other drugs seemed not to be necessary. I don't know, 1950s, 1960s, Brady Bunch, it was a fun time off from school. So here we have another clip from another article. They say that the infection was normally mild, that they rarely gave gamma globulin, which was a preformed antibody. Probably they rarely gave it because they knew that that could cause lots of problems. And they said that it was the commonest disease in the world. Nobody was particularly upset about it, saying we must create a vaccine at this point. Here we have again, they say that the infection is over in a week. It's best encountered between 3 to 7 years of age. And the mothers reported how much good the attack has done their children and how much better they are after it, because it is a bit of a rite of passage. Before the vaccine came along, the children would get it at the appropriate age, and they would have a growth spurt, they would have milestones reached, and we know now that long-term into adulthood, that several of the major killers of adults today, there's evidence that could be prevented by this early childhood infection. Okay, so next slide. I just want to talk briefly about measles treatment, because if you go to the Ministry of Health websites, all you'll see is that there's a vaccine available, that the vaccine should be given, and that it has to be prevented because you really can't treat it. Because, well, if you end up in a hospital, you could end up dead like some of these babies did. Okay, so I'm in favor of quarantine. With the exception of if somebody has a child of appropriate age and understanding and they want to expose their children to measles like people did in the 1950s, to have a case of it when they could deal with it, when the child was well, when the parents could take time off from work, then that's different. That's different than taking your kid out to the shopping malls and exposing pregnant women that may be vaccinated and have limited, if any, immunity, or newborn babies or elderly and infirm who may not survive the attack. So I think quarantine overall with selected visits. And we know vitamin A, even the World Health Organization talks about vitamin A. And according to my reading on Israeli websites, that there's no reports of whether or not vitamin A was given to the children that entered the hospital. We know vitamin C, and I actually learned this personally in 2019 when I was presented kind of unexpectedly with a whole bunch of children with measles from the age of 2 years old up to 19 years old. And I had actually never treated measles. I'm an adult doctor, and adults generally don't get measles. I was a specialist in kidneys. And because the vaccine has interrupted transmission, we didn't see as much. And I don't think that's a good thing. And I've been through why I don't think that's a good thing, that it interrupted transmission. However, when I did start to treat, I remember one of the first children I treated, he was probably 11 years old. And I just asked the mother to take him to the hospital, because she literally had to put her arms under his armpits and walk him in, and he was nearly unconscious, and he had a confluent rash, and he was emaciated, did not look well at all. I started the IV vitamin C, and halfway through, the kid perked up and his rash changed in front of my eyes, and that's when I started to just feel a little bit upset that they say there's no treatment for measles, because here I was watching a treatment be really effective. And we know that when children are sick or before they go into the hospital, that they tend to have borderline vitamin C levels. And once you're in the hospital getting all the drugs they give you, you could wind up with scurvy levels, which this has been proven in several different studies where they measure the before and after hospitalizations. And I've been through these in the past with CHD videos. And then there's, dealing with skin care if there's really problematic areas. Highly densely nutritious food, preferably, in my opinion, cooked food. I don't think sick people should be eating raw food. And I know I'm going to get a lot of flashback, but I want things to be very easily digestible, easily absorbed, and easily assimilated. So stews, kind of warming foods like that, I think are really good for children, and hydrating. You want lots of broth and watery things to keep them very well hydrated, and rest. And this whole thing about putting them in the dark room, no, sorry, that is not a good idea, because you're ignoring what the real problem is. And the real problem is that that child is vitamin A deficient if they have photophobia or pain or problems when there's light. You need to get them out into the sunlight, actually. That's probably a better treatment than putting them into the dark. Okay, so the next slide, I just talked about how the death rates had gone down. And so here we have the measles vaccine was introduced in England and Wales, 1968, and already we have the death rate hugging the baseline to near zero. I've shown the USA graph before, so I'm not going to show that. But here's another one, the next slide here. I believe this is Denmark. It's Denmark. And every country shows the same thing. I also had a graph that I used to use up in Iceland when I visited Iceland. And so why might parents not be vaccinating? Why are they ignoring what all these recommendations are? Well, maybe they know about this death rate issue. And the next slide, maybe they realize that once their child has been fully convalesced from measles, that they have stronger, more durable immunity, and that their health may actually benefit from an infection. And so the slide after this is a study by Klingele, where it was done in 12-year-olds, and they looked at the blood of Nigerian children who had natural immunity to measles versus Luxembourg children who were vaccinated. And the question was, is there a difference in the ability to fight wild measles types among those different groups? Okay, and the next slide shows us that yes, there is. The Nigerian naturally immune children were able to neutralize 12 out of the 22 different strains. 12 of the 22 late convalescent sera were able to neutralize, and only 6 of the 24 vaccinees neutralized all the viruses. So we see a difference between 25 and 54% ability to neutralize viruses between the different kinds of immunity. And the next slide shows that they looked at different virus types as well. And 10% of the virus types were not neutralized in the Nigerian naturally immune, and 50% were not neutralized in the Luxembourg vaccinated children's blood. So again, there's a big difference between natural convalescence. And so that's possibly what these Israeli factions that aren't vaccinating know about, okay? There may also be religious and spiritual things, which we'll talk about as well later. Next slide. This is a quote from Dr. Peter Abbey, who said that children who survive the acute phase of measles, and this is in Africa, okay, it may have survival advantage compared to unimmunized, uninfected children. Both disease and immunization may be associated with non-specific beneficial effects. So we talk about this non-specific beneficial effects. Now, Peter Abbey is an extremely conservative person who I don't actually agree with, but once in a while, some of their studies show some interesting things, and this is why I use this quote. We do know that if you read Dissolving Illusions, or if you read Aaron Seery's book, Vaccines Amen, which has a lot of details about the lower cardiovascular risks and lower cancer risks later on that have been measured in large studies. Okay, so the next slide, I want to address the issue of doctor treatments of measles, because it's been a long time that when children do present to hospitals, it wasn't just last year, the Texas deaths with the malpractice. It's been going on for a long time. People, doctors in particular, just having kind of dogmas and traditions rather than things that actually work. So there was this guy, Dr. Witsenburg, and this is published in the Journal of Anthroposophic Medicine from 1992. And so Dr. Witsenburg was in Ghana, and he was looking at this measles outbreak, and he was absolutely appalled at what he was seeing, because there was a very high death rate in these children that were being treated by his fellow doctors. Okay, so the next slide. The usual treatment was sedatives and I don't know why I wrote that. Just sedatives. Sedatives was one of the treatments. Antipyretic drugs. So we know about those just to lower that means fever lowering, and things called antitussives and antihistamines to stop cough, which is a really bad idea, and treatment of manifest or subclinical malaria. Yes, you do want to treat malaria. Antibiotics as required for pneumonia, enteritis, etc. There was some blood transfusion being given and general measures such as bed rest, fluids, and diet. And so the gold standard treatment yielded a 35% death rate in these children. Okay, that's super high. Like even when we saw what was going on in Samoa several years ago, I think the death rate might have been like 3% in the case fatality rate. And in Israel, I did the numbers on this about a little more than 0.5%, which is still really super high. So we have a 35% death rate here. So this guy was like, come on, people, we got to do better than this. This is not what I went to medical school for. So what he did halfway through this large epidemic, he was able to stop all the drugs in half the children, and they were just treated with bed rest, fluids, and as good of a diet as possible. Okay. And yeah, you have the right slide up there. And there was no vitamin C or vitamin A documented given at this point. Okay, so just imagine if there was. But just without that, the next slide will show us the results, is that the death rate remained at 35% with the usual treatment. Now, remember, that should be considered illegal to keep doing that after we realize this. Because if it was vaccination, of course, everything gets flipped around. But what happened is his mortality rate dropped to 7% with the non-interference group. That's an 80% drop in the death rate. And his colleagues still said that they weren't convinced and that he probably was just lucky. So this is the kind of mentality that we're dealing with. And there have been a lot of wrong things done in treating diseases over the decades, and in dissolving illusions, we go through lots of them. When it came to smallpox, mercurials and arsenicals, and when it came to polio, the treatments that were given to severed tendons, and these treatments that are wrong or ineffective and not acknowledged as such, or thought to be the best they have to offer. Can be the reason why it looks like there's a high mortality from the actual disease, when in actuality it's contributed to by incompetence and lack of thinking outside the box by the medical providers. All right, so the next slide, I just summarizing everything here, is that measles should be a mild infection, okay? And natural immunity is way better than injected simulated immunity that the medical system has always done some harm. Okay, possibly inadvertently, out of ignorance. So I'm guilty of that too. And so I used to treat hypertension like it was a disease, okay? So we've all been blindfolded from time to time. We know about the 2 Texas cases in 2025 that Polly and I and CHD and, Brian Hooker and Pierre Corey, we've all been through that it really was a case of mismanagement within the hospitals. It was not measles that killed these children. And yes, all the pro-vax are screaming and yelling, well, it wouldn't have happened if they didn't have measles. They got the super infection from that, blah, blah. Okay, well, you can get secondary bacterial infections from pretty much any viral infection. Okay, so the situation in Israel is just not adding up here for me, and I'm just trying to work it out. So I've been like a whole day just going through the news and thinking about things, and in my opinion, this has to be about narrative control. It has to be about legal protection of some medical institutions, like why we're not getting the delineations, why we're not hearing about the strains, why we're not hearing about what the underlying conditions really were. There's something else going on here that I haven't quite figured out. So this is speculation. What's coming up is speculation from me, because that's all I can do. So the next slide is showing us, when I did a search of what the case rates and the death rates. So the first column is the year, the second column is the case rates that are reported, and the third column is the death rate. And you can see 2018, 2019, we've got 2,000 cases in 18, 2,300 in 2019, and how many deaths? One out of 2,000, one out of 2,300. Okay, that's probably to be expected. Now, let's skip to 2025, where all of a sudden we get 2,500 to 2,900 cases, and we've gone to 12 to 13 deaths. And then in 2026, there's an additional, there's a lot of variation in the numbers here, but they say 100 to 300 more. And now we've got 3 to 5 more deaths with a total of 17 deaths. The latest being a 17-year-old. I don't know, the magic number 17 seemed to come up this past week. So why? Why this high case fatality rate? This is not normal. This is not to be expected. There's something going on wrong, in my opinion, somewhere in either in society or in the hospitals or in the reporting. Okay, so next slide has my speculations why this could possibly be. Well, what we keep hearing is that it's the ultra orthodox, ultra orthodox, ultra orthodox, and we know that in Brooklyn and America that there are factions of ultra orthodox. We also know there's kind of ultra orthodox Christianoid, like the Amish and the Mennonite, and a lot of spiritual people just really don't want things that humans made up that contain animal matter and placental cells and chemicals and manipulated viruses being injected into their babies. Gee, funny that, isn't it? So yeah, it's usually people that are spiritual and kind of on the edge of spirituality, like they're calling them the ultra orthodox in this particular case in Israel. I think that there's probably a lack of awareness of nutrition, of the benefits of sunlight. And look, I mean, let's be fair here. Like, Israel's a bit of a desert. I've never been there, but I imagine that when you do get out in the sun, it can get real. And I'm pretty sure that ultra Orthodox people aren't going to be like going out like I do with like almost nothing on to get as much of their body tanned as possible. And they may not be putting their children out into the sun. They may not know how to do it in a healthy, safe way. And then vitamin C, A, and D, like what's going on there? Something has to be going on. And then the third bullet point is the doctor's harm. Like, we know that there could be delays in diagnostics. We know that the antibiotic choices can be inappropriate, and there could be kind of shuffling along and not changing it over quick enough when they actually have the information. We know that sedatives are often given to calm the child down. And that's one of the things that happened in the Texas case. And then the acetaminophen and ibuprofen, holy moly. I mean, 9 doses of just the acetaminophen with tacking on ibuprofen to this little child in one day. Not to mention that, the McDonald's food that was given to her. She had nothing nutritious given in the Texas case. And then we have to question whether there's some discrimination going on here to the ultra Orthodox. We know that, I didn't know this until yesterday, okay? But there is apparently a religious secular divide within Israel. And there's philosophical differences between the religious Zionists, the secular Zionists, and the religious ultra-Orthodox. And there can be some resentment towards the ultra-Orthodox. And as I understand, I've listened actually to several rabbis over the past, my time, but yesterday actually especially. And how I understand it is that a lot of the ultra-Orthodox, they're really, they really lean on the spiritual. God is guiding us. God has to guide us. And they don't believe that the occupation of Israel is God ordained because human hands pushed it through. And they believe that their promised land will come to them by the hand of God in the future, after the Messiah. And I might be messing the details up on this somehow, so please forgive me if I am. But the Zionists obviously do believe that it is their land and that they can fight for it and that they could be warriors. Ultra-spiritual people, even throughout biblical scriptures, they don't tend to emphasize the warrior nature of existence, whereas the Zionists are like, we're going to fight now. We're not going to take this lying down like a bunch of wimps like you people who don't want to send your children to the military, because the ultra-Orthodox don't want the children to be in the military. They want them to be home learning, being schooled about their spiritual philosophies. And so we also know that Israel's been, in in a lot of conflict, especially since 2025. I have on this slide, yeah, because my last bullet point there is actually not correct. After some further thinking and investigating, it does account for 2025 because I didn't actually realize that Israel was involved in conflicts in 2025. And in fact, the first conflict that involved, potential threats, bombs, and actual bombs going on in Israel was, I believe, in July of 2025. And then the first case of measles, so it was the first death, I think, came up in August of 2025. Okay, so here we have now, you can go back there, Lou, to 2024. And I just looked up, what were the direct threats and conflicts in 25. I asked the AI, basically, were there actual threats to the homeland of Israel during that time? And look, this isn't about Palestine, who's right, who's wrong. I'm just talking facts here about where the bombs were dropping, okay? I'm not being political. And so we know that there was the Israel-Iran direct conflict. That's all detailed there. The next slide talks about some other engagements, Lebanon, Hezbollah. So yeah, so 2025 was a bit probably stressful for people living in Israel because of the conflicts. And I would dare to say that a lot of people that live in Israel don't really want a bar of any of this, just like the people that are living in Iran. I've got Iranian friends right now, and I was just actually visiting with them recently, and I asked them what's going on with their family and their friends, and they say, look, it's people outside of Iran who think this is a really good thing, this liberation thing. Most people within Iran, even though they did not like the government, they really don't like this bombing thing that's going on, and they're really unhappy about it. So take that for what it may be. So I think a lot of people within these countries, like, who would be happy with bombs dropping around them, even if they're told it's targeted? It's stressful. It's extremely stressful. It's stressful probably for transportation. It's stressful on hospitals. Hospitals have to deal with the wounded, and it's very disruptive. And we know that, if you look at any society that's breaking down, if you look at when the Soviet Union broke down, the death rates for diphtheria went through the roof, despite being a hugely highly vaccinated population, because medical care was just completely disrupted. The place was really it was really a big mess. Alcoholism went through the roof, and so anytime there's this kind of societal stress, you're going to see more diseases and you're going to see worse outcomes. Okay, the next slide, 2026. So this was interesting. So somebody on my X page pointed me to a lady named Yafa Shiraz, who is a journalist in Israel. And I went scouring through her X page, and I found a couple of things, but this was the most interesting. Okay, so let's just start. This is my opinion, the top bullet point, that I think patients are not treated the same if they're not vaccinated. And I think Polly and I can talk about this afterwards, but, over the past few podcasts we've done, we've shown some clips of, nurses who take it upon themselves to go jabbing babies and treating patients the way they think they should be treated. And so there is hostility of people that don't share their own philosophy if they're kind of uninvolved people. And so Yafa Shiraz basically talked about this philosophy that the person carrying the disease can be more problematic than the disease itself. And I think that we do see a lot of that within the anti-vaccination group. And then the third one really piqued my attention, and I had to use Google Translate for this. But apparently, the Ministry of Health put out a guidance about measles cases during war. And it said that such a patient will not be transferred to a protected area during an alarm for fear of infecting others. In other words, a hospitalized person may be left unprotected during a missile strike, not because there's no way to protect him, but because he has been defined first and foremost as a risk to others. And so I looked around to find kind of any evidence of this, where this guidance came from. And on the next page, I couldn't find the exact guidance, but there certainly seems to be some sort of a policy within Israel about highly infectious patients being isolated in place rather than moved to shared protected areas. So I don't think that this is untrue. It's probably some sort of an ethos that's going on. Whether or not that could have contributed to some of the, non-standard care, if it happened to these children who did not survive, I don't know. But we do know that that is something that goes on. Okay, the next slide. Again, so I was really curious about the social tensions between these different sectors of, philosophy, the ultra orthodox versus the different kinds of Zionists, and they talk about here the key points about the tensions really has to do with a lot of it unfair burden sharing because the Haredim, that's the ultra orthodox Jews, contribute less to taxes and the workforce while receiving high state support, supposedly. And there's the issue of the boys, the men not being conscripted to the draft. So there can be some contention towards these people because of that. Okay, something I asked, next slide. I started just asking questions and getting answers. And so the Haredi societies explicitly, a smaller subset within them is explicitly anti-Zionist, viewing the establishment of a Jewish state before the Messiah's arrival. I already went through this, so we can skip over that. Next slide. So the sect within Brooklyn and parts of Israel have been repeatedly linked to lower uptake and outbreaks of measles due to insularity, distrust of secular government authorities, and of course, misinformation spread via community networks like you and me, Polly. Okay, and so there's hesitancy, there's vaccine hesitancy within this group. Next slide. They have more negative attitudes towards vaccine safety, benefits, and health authorities, often relying less on professionals and more on alternative sources. Of course, and they listen to fringe elements about anti-vaccination. And next slide, 32. So I also wanted to know if the ultra-Orthodox tend to avoid contact with the medical establishment, because we do know I remember some cases in Philadelphia decades ago, maybe this point, well, maybe 15, 20 years ago, where the people so did not want to interface with the medical system that they waited a very long time to the point where the child probably could have been saved if it got proper help, and it wasn't. So that is a potential problem. I mean, it would be different, I suppose, if we had, a compassionate and honest medical system that maybe people would be more willing to walk into it. But yes, these ultra-Orthodox people in Israel and elsewhere tend to avoid and minimize contact with the broader medical establishment when possible, though this is not absolute and varies significantly by subgroup. So that's a potential issue that, the children were getting really sick at home and the parents were trying to deal with it. They probably didn't have what they needed to deal with it. They probably didn't know about vitamin A, C, E, nutrition, sunlight, and, non-native EMF and blue light and everything else that we know about that can, really block up the electrical system in a person's body. And so you always want to restore baseline health as much as possible. I always talk about this. It's not just about dealing with disease. I also am a terrain theorist, okay? And I think establishing baseline health should be done for everybody, no matter what's going on with them, but especially if they're sick. Okay, so if we could just skip to slide 34. I have a few questions, and the question, were these patients, when they arrived, were they jabbed with the measles vaccine on presentation? That is not beyond the realm of possibility. That happened in Samoa, and I believe that it was one of the reasons for the high mortality rates that we saw there. How many doses of these anti-fever medicines were given, which we know is like shooting your attack dog when your house is being broken into. It's a really stupid and unnecessary thing to do, yet it is actually written into hospital policy and into admission orders, so the doctor doesn't even need to be called. And then what's the nutritional status? I don't know really much at all about if there's even any uniformity within the Haredi community, what the nutritional status is, but that is an important thing that everybody needs to pay attention to. Could there have been some scurvy? And then we want to know what was the isolation policy and the attention paid to patients. And when you talk to people, that have been on isolation during COVID, for example, that the hospital staff doesn't want to gown up and put masks on and go in and visit them. So in general, people who are in isolation tend to get skipped over a lot. And so unless the parents are in there and really know to keep everybody on the ball, there could be less attention paid to these children. I would like to know what the strain or genotype is of this infection that's circulating in Israel right now. And one of the things we saw in Samoa was that a lot of the cases were turned away from hospitals and GPs, like once, maybe twice. And we saw this in Texas, like they would be told to go home, and they were not well. They shouldn't have been told to go home. I mean, I guess it's really hard to know with a flip of the coin, because if you go home versus having incompetent medical providers taking care of you, but that could have been a problem here as well. And so were they turned away, and then came back when they were super, super sick? That's also a possibility. The next slide, I'm just resurrecting this headline, because this was from 2015. But look, I'm sure we can find this still going on today. This is absolutely the ethos of journalists and of public health providers, of pro-vaccine doctors, that if you want to change an anti-vaccine parent's mind, scare the crap out of them. And it works. Like we've seen it in North Carolina, the vaccination rate went up. And look, let's face facts that vaccines have lost a bit of public credibility after COVID. Now, and I think I'm one of the only people that hasn't lost friends during COVID, because I already lost all my friends during the 2011 when I started noticing the problems and speaking about it. But a lot of people lost friends, and it's very disruptive. And the fear campaigns are orchestrated and they are real. And the next, okay. I just decided to look and see, like, what's the SIDS rate in Israel? And what we find is that there's 50 to 80 deaths per year in Israel of SIDS. And yeah, well, what is SIDS anyway? Well, I think most of us have an idea what it is. And I think there have been different studies like CotWatch by Vera Scheibner and her husband that tracked what SIDS really is. And a lot of parents report that SIDS seems to happen very rapidly after certain injections are given. So that's a really high death rate. Well, we're not hearing anything about that, are we? No. And then lastly, very last slide, just bringing this up again, because even though this vaccine isn't technically being distributed, it has been developed, a highly immunogenic and effective measles virus-based Th1 biased COVID-19 vaccine. And I just think when you start tinkering around with the genes and viruses and creating vaccines and even trialing them in small groups, it has an effect on, I should say, it has a potential effect on the circulating strains of different viruses. And we do know that the measles virus was probably one of them that was the most difficult to get to transform and mutate due to vaccine pressure, but it has happened. And that's that study that I showed you early on about the Luxembourg versus the Nigerian children. Well, a lot of that would have been due to vaccine pressure that's put on the natural strains, and why those vaccinated children aren't able to respond like the naturally convalesced. Some of it has to do with the route of infection being naturally coming through the right channels, the right gates, and getting full spectrum immunity, and injecting through a muscle not. But I think in my back of my mind, I'm thinking, okay, what else is going on back there about what these scientists are doing and what they're tinkering around with, even in small trials that could have effects in broader places. And with that, I bring Polly back to see what she's been doing over there.
Yes, very interesting. Thank you, Dr. Suzanne Humphries. Let's talk about, for a second, can we just talk about what unvaccinated means? Because here's the issue I have. I mean, I just had a couple of calls from people in England because meningitis is killing everybody. Well, it's killed people who went to hospital, just like the measles killed the girls that went to hospital. I mean, the hospitals are killing. I don't care if it sounds crazy. We saw it in COVID. We're seeing it again. There's a measles hospital protocol, and there's now a meningitis hospital protocol. It is incredibly dangerous to take your unvaccinated child to hospital in this day and age, and that is a fact. Because there's nothing, I'm telling you, if you take your child in with measles to hospital, doesn't matter where it is in the world, and your child has had umpteen MMR vaccines, your child will not die. But if it's unvaccinated, it will be treated differently. We've seen it over and over again, and we're seeing it again, Dr. Suzanne Humphries. Now, you may
That's
not want
right.
to comment on that, but it's a fact.
No, I do. It's almost like a diagnosis. Non-vaccinated. I don't even say unvaccinated anymore, because I think that's a dumb term. Non-vaccinated. These people were non-vax. They were not vaccinated for a reason. And yes, when we look through the Texas medical records, and we know that doctors, when they come to the ward to see a patient, they're focusing more on documentation half the time than they are actually on the patient itself. There's really no time for lateral outside the box thinking at all. But we know that the notes, at pretty much every note that described these people, unvaccinated, blah blah blah, child with measles and likely secondary infection. Funny enough, one of the cases, okay, we measure immune globulin M and immune globulin G, IgM and IgG. IgM is what happens first when there's an infection, and then IgG is what happens later, and then IgM goes down, then you have IgG, and then you have your long-term infection. Of course, there's all kinds of cellular immunity going on as well, but I'm just talking about antibodies. And this is how hospitals will often test. And so one of the children that supposedly died of measles had a negative IgG. And so I kept asking, where is the IgM? I asked Ben Edwards to dig that up. I asked Brian Hooker to dig that up. And I'm not putting them on the spot because I don't think they were able to get it. I don't know what the hospital did with that data, with that IgM data. The reason I'm asking is because there is some doubt as to whether or not that child actually had measles. So if you're non-vaccinated and you go into the hospital with a rash that looks like measles, and lots of other infections can look like measles, like parvovirus B19, I think is one of them, back in the old days, probably some of what was diagnosed as measles wasn't actually measles. And so confirmation is a good idea. Regardless of the fact that you still want to give vitamin C to everybody, you might not want to give such high doses of vitamin A to a child who doesn't actually have measles, unless you can get a vitamin A level, but they're kind of expensive to get, and I don't think that's a routine thing in the hospital. So, yeah, so that's kind of another question I have is the diagnoses. They just jump to conclusions whether or not the perhaps laboratory testing supports it.
Yeah, and the other thing for people not to trust is when the media is full of 17 unvaccinated kids. Well, what does unvaccinated actually mean? It doesn't mean they've never had a vaccine. It means they're maybe just not up to date on their latest MMR, or they haven't had their latest meningitis, or whatever it is. They can use unvaccinated as a term for someone who's simply not up to date on the CDC schedule. It is that. We saw it again in COVID, and I'm sure we're seeing it again. It seems an awful coincidence that 17 unvaccinated people die.
Yeah, it's a very high case fatality ratio. I know the youngest that I could find on there was a 6-month-old. And in general, although they will sometimes jab 6-month-olds with measles vaccines under certain conditions, but in general, it's 1 year. So that particular child would not have been vaccinated, but all the other ones would have been old enough to at least had their first jab. Some of them would have been due for their second one, because I don't know if you remember this, Polly, but I've talked about this in the past, is that in the year that the measles vaccine came out in America, Dr. Langmuir and Sensor put out an article that said if only part of the childhood population gets one measles vaccine this year, that we will eradicate, not eliminate, we will eradicate the disease from the United States by the end of the year. That was the original promise. And what happened, by the time I went to medical school in the late 1980s, there were epidemics of thousands, 20,000, I think, 1 year, 22,000 the year before I went to medical school. This is all my autobiography, Rising from the Dead. I put a little chronicle in there. And so there were tens of thousands of cases of measles. And what they realized is that, okay, certainly that first promise, which is always the nose of the camel, didn't come true. And so not only did one vaccine not take care of the problem, so they had to, with which part of the childhood population, because by then they had covered the entire childhood population at least once. Then they added a second vaccine to the schedule. And so that's what we have now is the booster. And now we're told as older people that we should get a third one. So this is what happens. Oh, we had a little problem in the beginning, but we've overcome it. The way we overcome problems with vaccines is always to just give more of them.
Yeah, and it doesn't work anyway, because Dr. Ben Edwards, Brian Hooker, they've all got measles, and they're the only vaccinated ones. People like me who've already had measles naturally were fine. So I'm just saying, it does not work.
Yeah.
And that 6 months you were talking about, well, it may not have had the MMR, but it would have had a shed load of other vaccines, which have completely destroyed its immune system and possibly, I don't know, and all the other things. Right. Here's a question for you. Is measles good for you? Catching measles naturally, is it good for you?
Well, there's certainly some data that shows that if you survive measles, now this is what the vaccine enthusiasts are going to go, oh, but it can kill you, it can kill you. Okay, it can kill you under certain circumstances. A measles infection might kill you, but as you can see, we've got drownings that are higher than measles deaths. We've got a lot of kind of zebra diseases that cause more deaths than measles do in the developed world. Okay, so I just going to ward off that kind of attack that could potentially come. There is evidence that the immune system response that happens as a result of an infection with the measles, the high interferon, the cell-mediated immunity maturation that happens, that there is some evidence that cardiovascular disease, strokes, and cancers later in life are lower in people who have had and convalesced from measles. And in Dissolving Illusions, we write a couple of cases up. One of them, it just sticks out in my mind so much because it was a case of a child with something called nephrotic syndrome. I think they used to call it dropsy back then. And this boy was losing protein through his urine. It's not a good situation to have at all. And in those days, was deadly. Today, they would give you steroids and immune suppressants, and they would save you for a certain amount of time. But eventually, you're going to probably end up on dialysis or transplant and die of something else. So the family was gathered around the child's bed, and the doctors were trying everything, probably mercurials and all the kind of wonderful things they used to treat such diseases back then. And then the child contracted measles. And the family really grieved then. And they were getting you had your regular outfit back then, and you had your funeral outfit back then. And they were getting their funeral outfits all ready. And lo and behold, the child not only recovers from measles, even though he's losing immune globulin out of his kidneys like nobody's business, because cell-mediated immunity is more important in terms of dealing with measles, and cell-mediated immunity depends on certain vitamins and nutrition, which is why I harp on that. But his kidney disease went away, and he recovered and grew up. So yes, this is an N=1 case, but we also know that experimental cancer treatments use viral therapy in order to stimulate interferon and fevers, because we know that changes. What it really probably changes is the gelatin matrix and the exclusion water zones and organized water in the body and things like that, which I don't have time to get into, but that the high temperatures are actually very good and not to be fought off. And so it's the infection that was actually able to do that. And the downstream effect was to recover from this chronic disease that this child had. Well, there's also other factors involved in terms of the cardiovascular system and our immune system and cancers that I can't describe to you right now, but that have been documented epidemiologically.
And I just want to say to everybody, fact, Tommey fact, doesn't matter if it's not the views of Children's Health Defence or Dr. Suzanne Humphries, fact, more people have died or brain injured for life from the MMR vaccine than measles. We travelled around the bus from 2016 until whenever COVID started. And I can tell you this, we screamed out, is there anyone out there that's died of measles or know someone that's died of measles? Because that story is as important as the MMR injuries. Couldn't find anyone, even knew anybody that had remotely died from measles. So the conclusion of the People's study is that the MMR causes death and destruction. Measles, on the other hand, we met people who had measles and they were fit, well, and healthy. So there's that.
Yeah. And so one of the people that posted on my X page under this said that she's asked around, and she lived in one of the areas that supposedly was a hotbed of the measles. And she said she can't find one person that knows anybody that had measles, not only that died of it, but actually had it. And so that also leaves us the possibility, okay, this is really out on a limb conspiracy theory. Please, legal, don't cut this out because it's really important. But that it's possible that news gets made up or that it gets embellished. And, we had this case in North Carolina with encephalitis, and it was supposedly another radical religious woman whose child got measles and went into the hospital and got a spinal tap and then was feeling better. And after the spinal tap, starts to poop out, I think got sent home and came back with full-blown encephalitis. And this encephalitis was blamed on the measles. And the mother supposedly said, I didn't vaccinate him. And if I had it to do all over again, I still wouldn't vaccinate him. because I don't think the vaccine is worth it. And I want to know if this, so were taking pictures of the child in the room. It was in all the news outlets. So apparently this person doesn't mind being known. Is it a real person? That's what I want to know, because I would love to talk to that mother. And this is a call out to her. If she is out there, my email is drsuzannehumphries@gmail.com. Please email me. I would like to talk to you. I would like to understand better what happened in that hospital situation. And I would like to know that you're a real person, and that the news media didn't just pick up on something that might not have been true.
Which is very possible. All right, Dr. Suzanne Humphries, how can people get Dissolving Illusion, the book that everybody needs to have? How can we get it?
They can go, the best way is to go to dissolvingillusions.com. Everything is on there, how you can get it, how you can get my autobiography, Rising from the Dead, and how you can get Roman's new novel called Tender Mercies, and where you can get it in different languages. And if you don't want to use Amazon, you don't have to use Amazon.
Fantastic. Brilliant. I love this discussion. Thank you so much. Everybody out there, please stop panicking, fear-mongering, pray big. Thank you, Dr. Suzanne Humphries, and everyone, Lou and everyone behind the scenes, and we will see you tomorrow on CHD TV.
My name is Catherine.
How many children do you have?
7.
7. How old are they now?
They're 19 to 9.
Wow, 19 to 9. Okay.
Yeah.
So tell us, you've got a home study. Let's start with the first child. You were pregnant with the first child. Did you have a conversation about vaccinations?
A brief one. I just didn't know how many there would be needed to give in the very beginning. And I remember thinking, surely you don't need to give chickenpox. That was my only, surely not that one. But I just went on ahead with it and just followed what I thought I was supposed to do.
So your first child had vaccinations on schedule?
She did.
And your second child?
Vaccinations on schedule.
And your third child?
I stopped about 1 year in with hers.
And the rest of your children?
And then the next 2 had none. And then the next 2 are Chinese, and they were fully vaccinated before I got them here. And
all right, so well, that's interesting. So basically you have a whole mishmash, some children unvaccinated, some partially, some fully.
Yes.
Talk us through the results of your vaccine.
Yeah, so our first 2 were definitely sicker. I noticed they caught more things. When they got sick, theirs was more extreme than the 2 that I did not. They had a healthier infant life. They had a healthier childhood. And so that was interesting to observe. And I didn't connect the dots for some time, that it was vaccinated related with the first 2. When they would get so sick, say flu or cold, it just was extreme. And then with the next 2, they were able to get over things easier.
So the third child.
Oh, the third one, that's right.
She had a little.
She had it for a year. And I don't remember her infant toddler as much. I think actually I stopped at 6 months for her. And so she was definitely healthier. The next 3 were definitely healthier.
Because they had no vaccine.
They had, right. The next 2 had 0. And then then I started educating myself at this point. By I had number 3, I'm really educating myself. And I knew I didn't want to do it anymore. So then when it came along to go to China.
So you adopted 2 children.
Right. And I didn't want to give them any. And I knew they had been vaccinated there. So I signed the waiver that said we would take care of it when we got back here, because that's how they get you out of the country. So they had been fully vaccinated, though, both of them.
How are they?
They're 9 and 10 now.
Are they okay?
Yeah, they're okay. There's so many challenges because you've got the adoption issue along with what I think is a whole lot of shots in their system. So there's a lot of attention deficit, but again, it's probably, you've got the trauma and you have the shots. And then our 6th child, who's Chinese, has more allergies than anybody in the family. And that's new. We haven't really had that, but he definitely has allergies. So, yeah, and then I think I was really surprised when our firstborn went off to school, and she was only doing a 1-year program, and I worked really hard to not have to have her get a bunch of shots to go off. She was going to a school in Hawaii, and I worked really hard and did a lot of legwork, and I wish I could have had her own it herself, because we got it approved where she didn't have to have shots when she got there, because since we stopped doing shots when she was, I guess, 4, because we had a lot of kids close together. I birthed them close together. And so she was the one that I vaccinated a lot the first couple years, but then we quit. Once we quit. They didn't keep getting follow-up shots as they got older. And so she was called out of class one day, and I had it approved for her not to have any shots. And she got all her shots. And I I'd done hours and hours of research and got it approved.
To get them?
No, she just didn't. I think I didn't educate her enough to stand up for herself. I went to bat, but she didn't go to bat for herself. Does that make sense?
Yes.
And she said, well, they just told me. I said, but I spent the hours and hours. And she's had a really tough year. She's not felt well. No. She's been really fighting everything that comes her way, she said.
So what would you say to the young mum watching right now? Because you've done everything. You've had your own children, you've adopted children from overseas.
Yeah.
What is your actual overall summary? Should people vaccinate or not?
Well,
mother to mother.
Yeah, mother to mother, I would not vaccinate, but I do believe in good nutrition and building the immunity. And so I'm not saying do nothing. I'm saying that it matters what we feed our children, what the toxins they're exposed to, what's going on in their bodies and their shampoo. And so I believe with all my heart that it's building up their immunity in a natural way, not with extra toxins coming in their body through shots.
I agree with that. Anything else you want to add to this?
Thank you. No, can't think of anything else. Yeah.
Thank you for doing that.
This and all CHD TV programming is made possible by generous support from viewers like you. Please consider making a contribution today to keep our programming going strong. Thank you.